Good evening, everyone. Wynn Brown here with Heywood Healthcare's COVID-19 update for Monday, October 19th. As I mentioned on Friday, we are going to a Monday, Wednesday, Friday report because we're seeing some surge in our region and also on our inpatient unit. So I want to make sure that everybody is kept up to date with what's going on at Heywood and some of the planning that is underway to make sure that we stay on top of things as our community sees an uptick in COVID positive testing. So right to our numbers, we have 7 positive inpatients at Heywood right now, 1 in our ICU and 6 on Watkins 1. So first of all, thank you to our staff who are working under conditions where they have to be in full PPE to care for those patients, and also the staff on GPU that is in full PPE as well, caring for our GPU patients. We had 1 additional GPU patient's test come back positive today. That patient was transferred to Watkins 1 in an isolation room as well. We have 12 patients on GPU right now. All are in private rooms. Given that census, we have 12 rooms. So we have 12 independent rooms for patients there, which helps with social distancing and keeping those patients safe and well while they're underneath our care. I do want to note that we have seen an uptick, as I've noted earlier, especially in the 30, 40, and 50-year-olds, and even a few younger than that as well in our region. So please, again, we need to make sure that we're doing all the things that we did earlier in this pandemic and recommit to those, not only as a staff, but as a community, because I know a lot of the community sees this and this information gets out as well. So masks, social distancing, hand hygiene. I know we have schools back in session, sporting events going on. Please be very careful out there and be very smart, like we were when we led most of the state with our low positivity rate. So let's get back to that. One of the things that we began putting in place today is getting prepared to do tiered testing, COVID testing for our staff. And what I mean by tiered testing is the first staff that we are going to begin testing either late tomorrow or on Wednesday morning is our clinical staff on our inpatient units and the staff that are also regularly on those units, just out of abundance of caution so that we get a sense if there's anything else going on at Heywood and Athol hospitals to make sure that we have staff who are well, because as I noted earlier on Friday, all of these patients that have come from GPU and our staff that have tested positive are all asymptomatic. They continue to be asymptomatic. So we are going to go after this hard and make sure that we are doing all the things we can as an organization to make sure that we have the information we need to keep everybody well cared for. So just a preview of that for staff to know that that is coming. And again, we're going to do it in a tiered approach, starting first with our inpatient units and our testing tents and those kinds of things to make sure we're on top of that information. So that's where we are right now. I just wanted to give you a quick update tonight and as I try very hard always to be transparent with everyone, to let everybody have the correct information, and that's where we are. So thank you for your cooperation and for the hard work of everybody throughout the health system as we continue to battle this pandemic and this uptick that we are seeing. We couldn't do it without you as we continue our journey to be one of the best community-owned health systems in America. I'll get back to you on Wednesday with a further update. And as always, if you want to shoot me an email or give me a call, I'm happy to talk to you personally as well. Take care.